Mr. John, my name is Sandeep. I'm your nurse for today. How are you feeling today? Nice. So before I talk about the importance of lifestyle changes right into your daily routine, as recommended by doctor to lose 10 milligrams, I would briefly go over some of the important topics like type 2 diabetes. I already printed out the pamphlet, normal ranges, as well as BMI chart. Now, firstly, let's talk about type 2 diabetes. What is type 2 diabetes? Is basically a condition in which your insulin does, if your body does not produce much insulin, pancreas, as well as if it produces, it does not make proper use of the insulin. Now, why insulin is important? Because it's basically a hormone that helps to metabolize the glucose in your blood, right? You probably have heard the terms hyperglycemia and hypoglycemia. Hyper is basically high blood sugar and hypo is low blood sugar. Now, when it comes to the normal ranges, you need to understand this, Mr. John. The normal blood glucose range is 100, it's 100 or below milligram per deciliter, right? And if it's in between 100 to 125 milligram per deciliter, that is basically considered pre-diabetic, and over 126 milligrams per deciliter is considered diabetic. Now, risk factors are always involved with diabetic. If uncontrollable, of course, age as well as your heredity, means your family history, your genes. Now, the controllable are basically your obesity, overweight, as well as no activity, inactivity, right? Now, in order to decrease those 10 kilograms, firstly, if you look at the BMI chart, according to your height as well as your weight, your BMI index shows you're at 30, which is basically considered that you're obese. Now, in order to decrease that weight, in order to come to normal weight, you have to follow Canada Normal Food Guide, which basically helps you, which focuses, the meal plan focuses on the portion size. Let's suppose you have a plate. Now the plate has the fruits, half a plate has a fruit as well as the vegetables, whereas the other plate, other half has protein as well as the carbohydrates. That helps you to maintain your regular diet, as well as avoiding the food that has high sugar content, avoided the drinks that has high sugar content, processed food, right? Now, the second important part after diet is basically activity. 30 minutes of activity, Mr. John, 5 days a week. That will help you to stay managed with diabetes. Start with the best walking, just jogging, and then eventually start with the resistant exercises like lifting weight. Why it is important to prevent further complications like neuropathy, which is basically nerve damage. I have printed these pamphlets for you, which you can always refer and you can take it with you. Do you have any questions, Mr. John? Can you tell me your plan or tell me what did you understand? Perfect. I'm glad that you understand everything, and I'm glad you're ready to take pamphlets. If any information, please call us, and I'm very happy to hear that you're starting your activity even tomorrow. Thank you so much. If any questions, please call us anytime. Bye now.